is you're going to do a primary first, your neuro exam, then your secondary. So what I'm going to show you right now is we're going to do the primary and secondary just straight through, and then we'll go back and do the neuro.
Do you know what page that's on by any chance? Oh, right here, 163?
Yeah. You need it?
No, I printed my own.
All right, guys. If you didn't ready to hell up and get over here, we can start.
Blows popsicles down.
All right. Primary exam starts off when you get the phone, when you get the call over either the radio or the pager. First thing you have to do is, what's the first thing you do once you get on scene?
Check the scene.
And if you guys can, please don't look at your book because I need you guys to have known this by now.
Scene safety.
Check the scene
Scene safety. Before we do that, what are we supposed to do first? PSI. Now you guys have to understand that you guys cannot miss 1 point on primary, secondary, neuro, or OB. It's a failure. Okay? 1 point. If you look at these, some of these are 1 point. Some are 5, some are 30. Even if you get most of it right and just you forget one thing, like on the head, you forget to check the nose for drainage, there's nothing I can do. It's not Miss D, it's not me, it's the state. So you guys need to understand that. So we got our BSI on. So we roll up on scene. The first thing we need to do is pen man. So give me P.
PPE, personal protective equipment.
It's more than personal. There's two. There's personal and because it's a C size up, right? We want to make sure everyone's safe.
Yeah.
So it's personal and personnel safety. E.
Environmental hazards.
And
Number of patients.
M. And pen man.
Jordan.
The mechanism.
Okay. A. Additional resources. Yep. And
Number of resources.
not number of resources. We already have that. Need for extrication. And if they don't get it right away, guys, give them a minute before we start answering out, because I need to make sure that we all know this, okay? And I'm sure most of you do. So we've got our pen man. We're good on that. What's the next thing we need to do? If you don't know, look at the book.
It's
fine.
spine, if they're spine, a compromised spine.
Right. So in between pen man and AVPU, and this is a lot of things. I'm telling you, a lot of students forget. You have to mention inline stabilization. Okay. So make sure you mention
You have
that.
to say inline stabilization.
Say
or
yes.
Can you...
Say right after pen man. Say if need be, I would put them in inline stabilization. Okay. If it's a medical patient, more likely we're not going to. So all you're gonna do is say pen man, inline stabilization. Now we'll check AVPU. And AVPU stands for what? Awareness.
Responsive, verbal, non-responsive,
Non-responsive, right? Yeah. All right, so we've got all of that. What's the next thing we need to do to this patient?
Check airway.
What are we checking for in the airway?
Obstructions.
Okay.
Swelling.
Specifically what's on this sheet. What's the first thing we need to do to the airway?
Head tilt.
We need to open the airway. So head tilt, chin lift.
Or jaw thrust.
It's a medical, yeah, if we don't think there's spinal involvement, we can use the head tilt, chin lift. If we do, the jaw thrust. After that, we need to keep a patent airway, so we need to do what?
Suction.
No, listen, we need to keep a patent airway.
Oh.
How do we keep it open? Right, airway adjuncts as needed. Could be a nasal if they're awake. Could be an OP if they're unconscious. So we've opened the airway. We've got a patent airway. What's the next thing we need to do? No, we're still in airway. Airway's open. We've got an OP or an NP in. What's the next thing we need to do?
Suction if necessary.
Suction if necessary. Exactly. That's one of the most important things. Is a lot of people they don't look that far back in. They just open it up. Especially if it's a trauma patient, we could have teeth in the airway. We could have the tongue in the back of the airway. A lot of things can go wrong there. So we put the OP in. So we get our airway done. We move on to breathing. What do we need to do in breathing here? What's the first thing we need to check for breathing?
Check if they are breathing.
Check if they are breathing, and if they are, what are we looking for?
Adequate
Quality.
Rate and effort.
Rate and effort. But quality, yes. But make sure you get try and stick to as close to this as possible. If you can say rate and effort, that's going to be awesome. Because a lot of times, I've seen a lot of people doing lately is they're adding a lot more into the skill than they need to, and they're confusing themselves. So if you can just remember what's on the sheet and say that, and be gold, you're going to be golden. Okay? So we check rate and effort. He's good to go. So what's next?
Circulation.
We're still in breathing. Assist is indicated. So what are we going to do if